The oxygen shortage is quite critical. We only have one oxygen plant, and that is Inlay. And that oxygen plant provides oxygen cylinders for all the hospitals Inlay and going up into the Highlands region. And if you look at our case numbers at the moment, the surge at the moment is in the Highlands region. And hospitals are being inundated with patients requiring oxygen. And the ability to supply oxygen from this sole plant in Leh is rather very difficult. When you look at the oxygen demands of a severely ill COVID patient, the patient can go through one tank in a standard E-tank. The patient can go through that E-tank in about 4 to 5 hours at 4 liters or 3 to 4 liters per minute. And if you're only getting 50 tanks a day, and those deliveries happen 3 days a week, and you only get it from one plant, and you look at the surges that are happening across the Highland region, you can see that this isn't a dilemma, it is a catastrophe.
Yeah,
it's quite terrible.
Yeah, because it's just going to mean that you really are going to have no chance at all of meeting the needs of patients coming in.
I mean, when you look at it, we can't even provide the simple steroid dexamethasone, which is critical to assisting COVID-19 patients. And this again comes back to drug shortages, but very much similar. When you have a severely ill COVID patient, our best efforts are supportive therapy. And if we can't even provide the support, then there's very little else for us to do than stand beside the bedsides and practice medicine how it used to be done at the beginning of the century, where doctors just held the patient's hands and hoped for the best.
Are doctors seeking help from external help from countries like Australia and others to try and to sort of bridge these gaps?
I think what a lot of doctors have come to at this point is just like they cannot understand how we have had almost 2 years to prepare for this. And we have been telling the government, and we have been encouraging the government to get their act together, because this wasn't something that might have happened. It was inevitable that we would come face to face with COVID. And we were lucky that we missed the brunt of it that was experienced across the world at the beginning of the pandemic. And you would think that we would have had the time to prepare for it. But again, I think, as I've said continuously in previous interviews, this is a catastrophic failure of the government and its ability to forward plan with regards to this pandemic. And for all intents and purposes, this is what we're seeing now, the result of their failed efforts.
And of course, you're also, those efforts are impacting vaccination rates, which are so low that they're around 2%. And unless those increase, you're going to have very little chance fighting this any other way.
I hate to sound very Orwellian and place all the blame on Big Brother, but the honest truth is, even with the surging cases now within the country, there's very little publicity or drive from the government to increase vaccination coverage. What we really need to do is what happened in Melbourne and Sydney. There was a surge and it was pushed in the media, and you created FOMO. And you saw that vaccination coverage rates just increased on the back of it, exponentially. And none of that is happening in this country. And even now, like, people still think that what we're telling them about the situation in the COVID centres across the country is they balk at it and they laugh at us. And the only way to dispel that is to get it out to them and show them the realities of what's actually happening. But again, I can't see the government putting in the effort to get that done. I think for all intents and purposes, their biggest concern is the elections that are coming next year. And my biggest concern with that is that if we have this surge and it's Delta-related, and the way that elections are done in this country, you expect the cases to get even worse. So fingers crossed that they realise what needs to happen. But again, I like to be a pessimist. I don't want to be a pessimist, but it's very difficult not to see it that way.
It's hard not to be. And very concerningly, we're seeing a number of deaths among healthcare workers. And so I'm sure for your own safety and for the safety of your colleagues, this is becoming quite dire, because you need to protect yourself in order to do the best you can with the limited resources you have.
I guess one of the most alarming statistics with regards to our vaccination coverage is the hesitancy amongst health workers. Right now, the only way that they can get vaccinated is if they choose to. And for all intents and purposes, they have to make the right choice. I, for one, when the vaccine became available, got my first and second doses, and I've been more than happy with the vaccine and what it's done with me. And I feel more than confident in its effectiveness at protecting me at this critical time so that I can do better for other people. And right now, I think what the health workers need to understand is if you're not covered and if you're not looking after yourself, how do you expect to help anyone else? And I think that is something that all health workers need to take to heart and get out there and get vaccinated so we can get on and do the jobs that we can do, and do it with the mindset that we're covered and we're protected. But again, you can't say enough of why it has to be done, and it's largely down to the choice of these people and whether they want to do it or not. And again, like I said, a lot of the people who've been vaccinated, there is just a disdain to keep going with the conversation, because it's, again, we've been having this conversation with regards what to do with COVID, and then when the vaccine became available, we've been talking about it, and people just are not wanting to listen. They're hearing what we're saying, but they're not listening. And so again, like with the election and the COVID and all that, you can only see imminent disaster on the horizon. And I don't want to look at it like that, but it's very difficult not to.
Alfred, we appreciate your honesty, and it is such a complex situation, and we commend you for continuing the fight and doing the work you're doing. Thank you so much for your time.
Thank you very much always for the opportunity to share our experience.
Yeah, let's hope.
And good night.
Yeah, good night.